हाय एवरीवन, मेरा नेम अनुज कुमार है और मेरी एज 33 इयर्स है और मैं नोएडा का रहने वाला हूँ। मेरा हेयर लॉस अराउंड 5 इयर्स से था और मैं जब मेरे एक दोस्त ने मेरे को बताया कि डॉक्टर सारस्वत से आप मिलो, तो मैं इनसे आके मिला। इन्होंने मेरे को सारी चीज़ें एक्सप्लेन करी, एक एक चीज़ बताई और फिर मैं यहाँ पे ट्रांसप्लांट के लिए आया। तो सारी टीम ने मेरे को ईच एंड एवरीथिंग जो भी मतलब ये यूज़ कर रहे थे, जो भी काम कर रहे थे, काम करने से पहले कि जैसे मैं अब तुम्हारे ग्राफ्ट डालने वाले हैं या जो भी प्रोसेस था, एक एक चीज़ इन्होंने पहले एक्सप्लेन करी। फिर इन्होंने सारा काम स्टार्ट करा। उसके बाद सारा काम होने के बाद भी ये लोग सारा मेरे कंटिन्यूस कांटेक्ट में हैं। इवन डॉक्टर भी मेरे से एवरी मंथ पूछते हैं कि क्या कंडीशन है अभी, कैसा चल रहा है अभी, और क्या खा रहे हो अभी, किस किस चीज़ को ध्यान रखना है, सारी चीज़ें मेरे को लोग बता रहे हैं। इवन अभी आप देख सकते हो ये 4 महीने मेरे को हुए हैं, 4 से 5 महीने होने वाले हैं और मेरा ये लगभग 35 और 40% के अराउंड ये रिज़ल्ट है और काफ़ी कॉन्फिडेंस मतलब इम्प्रूव हुआ है। कहीं भी आप जाते हो तो एक अलग चेहरे पे ग्लो होता है इसकी वजह से। बहुत सारी चीज़ें हैं जो ज़िंदगी में पॉजिटिव हो रही हैं अभी। तो ये रिज़ल्ट जो है अभी 4 से 5 महीने का है। आप लोग भी कनेक्ट कर सकते हैं एक बार डॉक्टर साहब से। एक बार अगर डॉक्टर साहब से आप बात करो, एटलीस्ट आपको कराना है नहीं कराना है वो तो सेकंड चीज़ है, बट उससे पहले आप एक बार डॉक्टर साहब से बात करोगे तो आपको अच्छा लगेगा। इन्होंने पूरी चीज़ एकदम स्टेप बाय स्टेप सारा डिस्क्राइब करा कि यार अब क्या होगा, बाद में क्या होगा, कैसे होगा। और इवन ये हमेशा टच में रहते हैं, पूरी टीम एकदम फ्रेंडली है। अगर आपके मन में कोई भी क्वेश्चन होता है आप मतलब पूछ सकते हो। और ये लोग ऐसा नहीं है कि यार आप ये क्यों पूछ रहे हो, आप क्यों मतलब इतना क्यों परेशान कर रहे हो, ऐसा कुछ नहीं। अगर तुम्हें दिन में 5 बार फ़ोन करना है, 10 बार फ़ोन करना है तो मतलब 100% ये आंसर करते हैं, सारी चीज़ों को अच्छी तरह से बताते हैं। तो मैं चाहूँगा कि आप लोग एक बार कनेक्ट करें और फिर अपना हेयर ट्रांसप्लांट का प्लान कर सकते हैं।
So you just listen the experience of Mr. Anuj and how hair transplant helped him in gaining confidence and how he could go back and meet people with more confidence. So this is what hair transplant does. Friends, in this video, in our series of hair transplant results, we will share the results and discuss the planning and execution of Mr. Anuj. It is a step-by-step hair transplant journey of Mr. Anuj in which we will be showcasing his fantastic results at 5 months only. So this video is going to be very useful for you if you are also planning your hair transplant, and if you have a query in your mind about how the hair transplant is planned, what all steps are done by the team and the doctors in discussing the number of grafts, how they plan out the number of grafts, what kind of results can be predicted by the latest technologies like trichoscopy and all. So this is what we'll discuss. So keep on watching this till the end, because in the end we have his combing videos of dry hairs as well as wet hairs. I am Dr. Satya Saraswat, an American board certified gold medalist plastic and cosmetic surgeon doing hair transplants since 2006. We have an experience of around 18 years with hair transplant and have done thousands of such cases. At our center, we also train young doctors. So if you're a doctor who wants to train themselves in the field of hair transplant, the latest technology, this video is useful for you also. So let us go with this, and if you like these kind of videos, please subscribe to our channel. So Mr. Anuj was suffering from grade 3 male pattern baldness for last 5 to 6 years and had taken some treatments from some doctors which were not useful for him, although he tried them a lot. In his family history, he had a similar kind of hair loss on his father's side, paternal side. So we told him about the problem, the diagnosis, why he is having this kind of hair loss, and why hair transplant may be the only solution for him to get his hairs back, because he had tried the proper medical treatment but it did not work out for him. So with this grade 3 male pattern baldness, we planned out his surgery. We first did his trichoscopy, which, as you know, is a software-based analysis of his donor site where we check out the average thickness, the ratios between terminalis to vellus on the donor site, also the average density of the hairs at the donor site, average hairs per graft or per follicular unit which is there in this patient. So all these things we analyze step by step. So we found out that on his donor side, his average density was around 80 follicular units per centimeter square, and his thickness was also around 0.07 millimeter or more. So his donor side was good, and we were quite confident that we would be able to deliver results in his case. After discussing this, we took out the area of the recipient or the ball site. We calculated it in square centimeter. This gives us a pretty good idea about the number of grafts which are required. His area at the recipient or the ball site was around 73 square centimeter, and there are scientific ways to measure it very accurately, and this is very crucial so that we know the exact number of grafts which are going to be required in a particular case, or say your case. In the front, he along with the thin hairs had some thicker hairs also. So we decided on a density of 35 follicular units per centimeter square, which was around 45% of his normal density at the donor side. So with this calculation, we calculated that he needs around 2500 to 2600 grafts. And then we discussed all these steps in detail. So we have a policy where we discuss each and every step, the kind of results he can expect. We tell them with all the scientific data in all our consultations. So Mr. Anuj was quite comfortable because he had come to us after seeing the results of one of our other patients, and that is how most of our patients come to us. And then we planned his procedure. So if you also think that this is the kind of planning which should be there in every case, every individual case, and this is how scientifically it has to be planned, please like this video. Now coming to very interesting part, how the hair transplant procedure is performed. Before the procedure, we get all the blood tests done, which include his hemoglobin, bleeding time, clotting time, other viral markers and liver kidney function test and all those things. We do a ECG, we check out the allergy, if a patient is allergic to the medicines, and we have had instances where we had to cancel a procedure when we found out that the patient was allergic to the medicines like local anesthesia medicines. So friends, this is very important point. Whenever you plan a surgery, just check out if the clinic is doing your sensitivity test or allergy test for you. We do it for the antibiotics as well, all the medicines which you are going to use. So after this, we give antibiotics, we mark the hairline. This hairline marking is done in consensus with the patient where he wants his hairline to be placed. It should neither be too low, too high, and there are a lot of factors, scientific factors which go into it, and we use a laser device to give very symmetrical kind of hairline so that there are no imbalances between the left and the right side, not much. And then we trim the hairs. Then we give the local anesthesia. Local anesthesia is given in the ring fashion all around, slowly with a very fine needle using some vibration devices so that even that minimally painful or uncomfortable sensation can be minimized for you and it doesn't become a scary procedure for you. After giving the local anesthesia, we inject some tumescence fluid at the recipient site, which means it's a cocktail of normal saline and some injections which are injected to decrease the bleeding, and some anesthetizing agent are also into that. After that, we make the slits first. We do the slit first approach. This minimizes the time between the graft extraction and insertion. Also, if you make the slits first and then take out the graft, by the time our team starts with the graft insertion, there is no bleeding there at the slits which we have made. So we follow slit first approach for last 7 or 8 years. It's very important that the slits are made in the normal angle and the direction and at the pre-decided density in the recipient side. So then we made all the slits in his case also, and then we changed him into a face down position, which is known as prone position. Then we started with the graft extraction. For the graft extraction, the machine should not be a very high speed machine. Very high speed machine can not only directly traumatize the graft or cut them, which is known as transection, but also can produce some heat which can damage the skin in the nearby areas also. High machines produce poor scarring in the donor site also. So then we extracted the required number of grafts from the donor site, which were then collected very gently by using ATOE, atraumatic forceps, so that there is no damage to the punched grafts. Then these grafts are observed in the microscope under magnification devices, and then they are sorted into 1, 2, 3 and 4 hair grafts. The softer one hairs are typically used for the hairline. After this has been done, our team starts with the graft insertion process, and after that we discussed with him all the precautions he has to take and his schedule for the hair shampoo shampoos, when he has to come for the hair shampoo, and how and when he should be doing his hair shampoo at home also. Then we discussed a date for the proper cleaning where we will be removing all his scabs and all. Also his late follow-up schedule where he will be coming for the therapies like PRP and all were discussed in detail with them. So friend, this is how standardized protocols are followed in a hair transplant procedure. If you yourself are looking out for hair transplant and you want to connect with us or our team, you can either call us on the numbers given here, or you can also write down in the comment section below, and we will try to reach out to you and help you in your planning at the earliest. And now dear viewers, you can see the combing videos, not just the dry combing but the wet combing also. Wet combing gives an actual impression about the hair volume which has been generated by hair transplant itself. There is always some minimal visibility of the scalp, but in a wet combing video you can see how fantastic the results of Mr. Anuj are. Do share this video with your friends or your colleagues or anybody you know is planning out for a hair transplant, so that they know how it is planned in a scientific way and performed in a standardized way. To know about the cost of hair transplant, you can click the video given in the link above.